A lot of times, if we use earplugs for tinnitus, your tinnitus will sound louder because you're blocking off ambient noises. For hyperacusis, it can be really helpful in the beginning, though we don't want to use them long term.
It depends sometimes. We don't want to overprotect our ears because then we're just reinforcing that to the brain that these sounds are not safe. And we actually want to go in and desensitize and train the brain to know that, hey, these sounds are safe.
Today, I'm joined by three Treble Health audiologists and tinnitus experts, Dr. Breanne, Dr. Ali, and Dr. Ramsay. My name is Dr. Ben. Let's get started with our first question. What does your tinnitus sound like? My tinnitus sounds like a high-pitched hissing sound.
Mine has sound like a high pitched tone.
Mine also is very high-pitched tonal.
My tinnitus is high pitched and it also has like a wah wah in there.
When do you hear your tinnitus? I hear mine when I'm falling asleep at night or in a very quiet place like a hike in the woods.
I do not have constant tinnitus, but I have heard it if I like after a loud concert or sporting event or if I'm really sick.
My tinnitus is also not constant, and actually the only times that I've experienced it have been with both of my pregnancies.
My tinnitus is constant and probably the most noticeable in the evenings around bedtime when I wake up, when I'm very stressed.
What is your favorite sound? My favorite sound is a calming river in the mountains of California.
My favorite sound are ocean waves at the beach.
My favorite sounds are rain noise and brown noise.
I love ocean sounds, but I used white noise for my habituation process.
Why did you want to specialize in helping patients with tinnitus? I loved the ability to connect with my patients on a very personal level.
My dad was experiencing tinnitus as I was graduating from grad school, and he was not able to find anyone to help him, which is why I sought it out for him.
In my graduate program, I saw how many individuals, even college age students, that were affected by tinnitus and noticed there was that lack of professionals in our industry that were willing to help those. So that's why I decided to specialize in tinnitus.
For me, it was after going through the habituation process and realizing that there are tools and techniques that work and we can get better.
What is one way to treat somatic or somatosensory tinnitus? Under the care of an osteopathic doctor, you can get a cervical neck treatment.
Physical therapy.
Dental treatment with the mouth guard.
I'm going to say massage.
Do you have tinnitus and need a real solution? Reach out to our team at Treble Health and you can schedule a free consultation where we can review all of the tinnitus solutions available for you. Our Tinnitus 180 program makes sure that you experience clinically significant reduction in your tinnitus or your money back. Click right here on the screen to schedule a free consultation with a specialist from our team, and we'll be able to point you on the right path towards relief and treatment for your tinnitus. Why isn't there a single cure for tinnitus? Yeah, this one's important. So even if we have resources, studying tinnitus treatments can be uniquely difficult, in part because it's hard to objectively define and measure tinnitus.
There are so many different causes for tinnitus, so a single cure may not help all of them.
Additionally, tinnitus simply hasn't been researched as consistently as other chronic conditions.
Yeah, all really good points. Um, we're still learning, and there's still a lot of neuroscience theories that I can piggyback and add to to your guys' answers as to why it's difficult to come up with a single cure.
What is one tinnitus myth that you dislike? That tinnitus inevitably gets louder over time. It's not true.
You just have to learn to live with it.
Because of tinnitus, I will become deaf.
I'm going to say medications, particularly antidepressants, benzodiazepines, that they would potentially make tinnitus worse or that you can't get better when you take these medications.
What is one thing you would like those with tinnitus to know? I really want everyone to know that there is real help out there. If someone feels like they don't have any options, that's not true. Definitely speak to an expert and get some help.
Piggybacking after Dr. Ben, there is hope. There are ways and resources for you to help manage your tinnitus and help you habituate.
You aren't alone. There are professionals that care about you and want to help you.
Don't be discouraged. Like we're all saying, you will get better.
What is your favorite CBT or cognitive behavioral therapy exercise? My favorite is the stop technique, which gets us out of our mind and into the present moment and helps us move on with our day.
My favorite is the 5, 4, 3, 2, 1 technique, where you use your other senses to really analyze your environment.
My favorite is progressive muscle relaxation, which involves tensing and relaxing different muscle groups.
I love all these answers. I really like the RAIN technique. There's an acceptance commitment therapy technique that I like that is referred to as the struggle switch.
Are sound machines helpful for tinnitus? Absolutely, they definitely are. I even have one in my hand right here.
Yes, having a very sound and rich environment can really help provide a good auditory redirection from your tinnitus.
Absolutely, we see patients every day benefit from using sound therapy.
Absolutely 100%. And layering sounds in our environment is so important. So, using our ear level sound therapy devices as well as the desktop sound generator is a great strategy.
Are earplugs needed for someone with tinnitus or hyperacusis? Well, tinnitus is ringing in the ears, hyperacusis is sound sensitivity where everyday sounds are too loud, and sometimes earplugs can be used for tinnitus, sometimes with sound sensitivity. Dr. Breanne, what do you think?
I say it depends. A lot of times, if we use earplugs for tinnitus, your tinnitus will sound louder because you're blocking off ambient noises. For hyperacusis, it can be really helpful in the beginning, though we don't want to use them long term.
I agree. I think it's important to meet with a professional that can help guide you if you are using hearing protection so you can ensure you're using it appropriately.
Yeah, all great answers. It depends sometimes. We don't want to overprotect our ears because then we're just reinforcing that to the brain that these sounds are not safe. And we actually want to go in and desensitize and train the brain to know that, hey, these sounds are safe.
Should people with tinnitus or hyperacusis avoid loud environments like a concert or a restaurant? Generally, no, loud environments are typically safe, especially when we do have hearing protection.
We should be cautious of loud environments, especially if they're over 85 decibels. That's when we would really want to use hearing protection. So, concerts, sporting events, any of those loud environments, we should be using hearing protection. But they are generally safe for those with tinnitus and hyperacusis.
I agree that most environments are generally safe, but it is important to understand in which environments, like Dr. Brand mentioned, that we do want to use hearing protection.
Mhm. It's important to have fun. It's important to experience joy and to attend these events. And when you do, just be ready with your tools, your protection when needed.
What has helped you the most manage your tinnitus? For this one, let's hear from Dr. Ramsay, who herself went through a significant tinnitus treatment with her own ears.
That started with sound therapy for me. I needed that relief. I needed something to help bridge the contrast between what I was hearing and what was around me so that I could focus, concentrate, work, see patients. And that also helped with just the overall anxiety. So for me, sound therapy was a real game changer.
I'm most excited about the Tinnitus 180 program by our team at Treble Health. What we created has been very effective for our patients, and 85% of patients using the Tinnitus 180 program reported significant reduction in tinnitus. And I'm really happy about how that compares to other approaches that are available.
I'm most excited about sound therapy combined with cognitive behavioral therapy because I've seen the positive outcomes that my patients have seen and have reported back to me. The change from that initial meeting to the last meeting is just amazing.
I agree with Dr. Brand. Tinnitus retraining therapy is still the most exciting to me because it's what I've used in clinic and it's what I've seen work for patients and help them really turn their life around. So it's still, it's been around for a while, but it's still the most exciting to me.
In terms of what I'm seeing coming down the research pipeline, I really enjoy Dr. D. Ritter's work. I know right now he's currently working on psychedelic assisted brain stimulation, so it'll be really interesting to see where that goes for the treatment of tinnitus.
Are online forums helpful for those with tinnitus? There's definitely value there in terms of having some questions answered by other people in a similar situation, but I'm also really cautious about the harm it can create with extra anxiety and insomnia related to endless searching down the rabbit holes?
I tend to find more negative comments from my patients who do go down that rabbit hole because the people who are still posting out there tend to still be really struggling with their tinnitus.
I agree. I encourage patients to take a very cautious approach to joining in on any online forums.
Yeah, I'm in agreement with what everybody's saying. I think that they can be really negative spaces sometimes for patients. And often things that we see written in there, we don't know what their story is. We don't know what they've done for their tinnitus. So I think it's important to stick with sites that are evidence based, educational. Our YouTube channel, for one, is a great way to gather good information that's actually going to be helpful.
Should everyone who has tinnitus get a medical workup? I would say yes.
I would say not necessarily. Everyone who has tinnitus should see an audiologist for a baseline hearing test at the minimum.
I agree. I think starting with an audiologist, getting a full audiological workup is important, and then based on those findings, kind of guide what the next steps are.
Yeah, not necessarily. So, agree though that seeing an audiologist is important, and certainly understanding what the auditory system is doing with the hearing test is going to be really beneficial, especially when determining the root cause of the tinnitus.
Does everyone who has tinnitus have hearing loss? According to the Hearing Health Foundation, 90% of tinnitus cases occur with an underlying hearing loss. Do you guys see that with your patients?
I would say not everyone has a hearing loss, especially showing up on an audiogram, but we can do otoacoustic emission testing that shows the function of the hair cells, and there could be some damage to our hair cells without it showing up as a functional hearing loss.
I would agree that number seems pretty accurate with what I've seen clinically. Like Dr. Breanne said, there's not always a hearing loss on an audiogram, so sometimes it's important to dig a little deeper to see if there's some underlying damage that can be detected.
Yeah, absolutely. Oftentimes, we're going to see a normal hearing test on a standard audiogram. And we do know that stress and anxieties contribute and can be a root cause to tinnitus. So it's not always going to be hearing loss associated.
Where do most people hear their tinnitus? One ear, both ears, or coming from their head? I've most often found people hear it from both ears.
I feel like a combination of both ears or your head.
I would agree. It's typically both ears or a patient feels it more central.
It can be all of the above, both ears, midline. For me, my tinnitus is in my left ear.
What time of day is it most difficult for your patients with tinnitus? Surprisingly, a lot of people report that after they wake up from a nap or wake up in the mornings, their tinnitus is just blaringly loud.
I also hear that right before bed is when it's the loudest.
I would agree with both of those, and then, of course, in quiet environments.
Transitions between the work environment and the home environment.
For those who have trouble sleeping with tinnitus, what is one tool or technique that you think could help them? I would really recommend using this, which is a sleep headband for tinnitus. Treble Health has these available. You can find them on Amazon, and I find them very effective with some thin speakers alongside the headband for each ear.
Practicing a breathing or meditation technique right before bed can also be very relaxing.
Similar to what Dr. Ben mentioned, we also have a tabletop sound generator that can be helpful.
I would say I really like an exercise. It's called Leaves on the Stream.
Well, thank you guys for hanging out with this amazing group of Treble Health tinnitus expert audiologists. We'll see you guys soon. If you're interested in speaking with a specialist from Treble Health, click the link on the screen right now. We'll be able to review what's going on with your case, identify the root cause, and provide some options for you to move forward towards relief and treatment for your ears. Thanks so much. This is Dr. Ben Thompson with Treble Health.